Great. Welcome everyone officially to our March Healthy Utah Community Learning Network webinar. We're excited for everyone that's able to join us live. And then for those that will watch this later, you'll get a lot of great information out of today. We have Rich with us, who's going to talk about an awesome platform and with the topic of how to track our wellness challenges for your communities with little or no budgets. We're excited today. This actually broke a record of the most registrants for one of our webinars. So Rich, you have a lot of people excited and interested in this topic. So we're excited to learn more today. I'm just going to go through a few intro slides and then I'll turn the time over to Rich. So just a few things. As a reminder, this learning network is part of our Healthy Utah Community designation. We have a lot of cities and towns that register for today, as well as other partners. So if you're already a designated community, thanks for being with us. And if you're not yet, we encourage you to look at that designation. We're excited actually next month in April in St. George at the Mid-Year League Conference. We'll be announcing our next new designees as well as our re-designees every 3 years. Our communities redesignate. So we'll be excited to share that next month. And then the next deadline will be August 1st for our fall application period for those that want to be designated, or if you're coming up on your 3-year timeline, then you'll need to redesignate as well. So you can get more information on our website about that process and the designation. And feel free to reach out if you have questions. We're happy to meet with you to talk about the designation. As a reminder, to be designated, you just need a letter of commitment from your mayor, a community health coalition, working on a certain number of strategies, and doing a community health plan where you're looking at the needs in your community and how you can improve overall well-being. For strategies, that our focus area at Get Healthy Utah is to improve active living, mental well-being, and access to healthy food. And so we know health is outside of all those areas, but those are kind of our focus areas here at Get Healthy Utah. And the platform we're going to hear about from Rich can help you do wellness challenges in these 3 areas. We're getting people moving more, eating more healthy, or being more, have better mental well-being. Lastly, I wanted to give a shout out for you to throw this Save the Date on your calendar. We do our annual Get Healthy Utah event. And so our event will be coming up in the fall on September 4th with the theme of Fueling Healthy Communities. Registration will be open in the next few weeks, and we'll send an email to all of you that are on our newsletter. So if you're not on our newsletter, join our newsletter. Maybe Morgan, you can throw that our website in the chat, and you can click on newsletter, make sure you're signed up so you can get our announcements from when registration opens. So we're excited to get together with all of our partners this fall at that event. So without further ado, we'll turn the time over to Rich Millar, who is the founder of Health Movement, and he's going to talk about what he's been up to in this awesome platform and what you can do to use it for data collection, analysis, reporting across employee wellness, public wellness, and personal wellness. So let me make sure you can share your screen, Rich, and I will stop sharing my screen. And we'll have a Q&A at the end after Rich presents. But if you have questions, you can throw them in the chat and we can just keep track of those as well for you all to interact. So thank you, and I'll turn it over to Rich.
Awesome. Thanks, Alicia. Okay, let me just make sure I'm going to share the right screen here. Okay, can everybody see? Can you see my screen okay?
Yes, we can.
Okay, I'm gonna minimize this. Okay, all right. Yeah, thanks. I'm really excited to be with you guys. Well, let me jump into my first slide, and then that'll kind of explain. I feel like you are my people. We are cut from the same cloth. So just a little bit about me, and then I'm going to jump into a demo of the platform and show you how I think it can help you. But I am the founder of Health Movement. I am so passionate about trying to help people achieve a healthier lifestyle. And so back in 2005, I started the dietetics program. I had this dream of saving the world from obesity and chronic disease. That's why I went into that program. Following up, I went into the Masters of Public Health program. and continued my journey of learning about the health world and how I could help. And in 2008, I took my first job out of college doing a work site wellness for a company in Salt Lake. And so since that time, I started to see some needs or some gaps in the market in how we can help individuals and organizations achieve healthier objectives. And so I became obsessed with trying to improve access and provide free solutions to organizations like yourself for both employee wellness and public wellness. And we're going to focus today mostly on public wellness, but just know that pretty much everything I'm going to show you today can also apply to employee wellness. So if your organization has an employee wellness need, or you're working with an organization that has an employee wellness need, they can also utilize health movement to track the goals. So I'll show you that. But what I found in talking to a lot of um, uh, entities like yourself is you have all these great programs and all these great initiatives and things that you're doing in the community, and a lot of you lack tracking tool to really get to collect data, get that feedback, evaluate it. And so I started to see this need. I saw the same need on the employee wellness side, with somewhere over 75% of all employers don't utilize a employee wellness tracking solution. The number one reason for that is cost, because there's really expensive tools out there that are great, but most companies can't afford them. So with that, I created Health Movement to try to fill that need. And so Health Movement, which I'll show you here in 1 second, is the first universal health tracking platform. It is free. It's a freemium model. I'll explain that in a second. Free for any organization to sign up and start to track wellness initiatives, challenges, push that out to the community, who can download a free app and track whatever challenges you want them to. And so we're improving access by providing these free solutions to organizations and trying to make it easier for you to collect, analyze, and report data. So I'll get into some more details. I'm going to show you a live demo of both of these. That we've got a web kind of admin portal that you log into on the website. And then we've got the app that is in the Apple and Google store, that the end user can download for free to track. It is free without limit. There's no cap on the number of users that can be there. So you're not going to have to worry about, oh, we can only have like 50 people or 100 people or whatever it is. It's also free for spouses, partners, dependents, friends to join. And it's built for organizations like you, businesses, health departments, cities, schools, rec centers, gyms, and more. So with that, let me jump into a live demo. And I'm going to first take you, I'm going to share my phone, and I'm just going to take you right into the app and show you what it looks like. So I'm going to start with showing you what the end user sees, what the end user experience is like. And then I'll take you into the back end and show you how you can create these challenges. Before I do that, do we have any questions before I keep going? Are we good? Okay.
Yep, nothing in the chat yet.
Okay. Just stop me. I can't see your faces right now because I've got this on my screen. But so Alicia, if you'll just stop me if you
Yep.
need. Okay.
Okay.
So this is the application. This is on my phone. I'm just scrolling on this, and I'm going to show you a couple of different challenges here. So we've got a couple of different, so you can create any type of challenge you want. The user experience, it's very easy for them to track these challenges in the app. The first one I'm going to show you is this employee wellness challenge. Um, I I don't want to show you because it's an employee wellness, but just because you can see sort of the functionality here. Every challenge has a name, a description, an image, which is customizable to you. This would be your organization's name and logo here, so they would see that. We do have the option to do team and or free for all challenges. For most of you, probably the free for all challenge would make most sense if it's everyone in the community competing against everybody or tracking this. But what I want to show you in this particular challenge is how easy it is for them to track and that you can have multiple goals within a given challenge. So you can set it up however you want. I'll show you that in a second. But you could have one goal. So you could just say, we're just going to track minutes of exercise, or you could have multiple goals. So in this particular one, we're tracking minutes of exercise, hours of sleep, and fruits and veggies. And it's as simple as they just come in here, they pick their value, and they hit track, and it's done, and it uploads. So it's a very easy system for them to track, very user friendly. There's a leaderboard, so they can see how they're doing comparatively to everybody else. And then at the bottom is their unique specific activity graph to each user. So this shows them their specific data, how they've been tracking over the weeks, months, or year, however long this particular challenge has been going on. And then below that is a comment section where they can encourage each other, etc. So this is an example of a challenge that has multiple goals. Now I want to show you something. So very, very easy to do. Also, once let's say you create a challenge, you create like an activity challenge. You want to promote physical activity. And so you create that challenge, they download the app, they can participate in your challenge, but then they can also create their own individual challenges. So right here at the top, they could create their own personal challenges. And we have it centered around sleep, exercise, nutrition, and happiness, which we say encapsulates mental, emotional, social health, all of that. So they could create their own health challenges. They could invite their friends and family. At the end of the day, our goal and your goal is we want people to improve their health. And so we want to give them as many tools as they can to be able to track whatever health goal that they want. So it's a very easy setup. They can do that themselves. So I want to show you, I want to take you into the website real fast. So I'm going to jump over to the website. This is the admin portal and this is showing some of those challenges that we were just looking at. So this would be your admin account. You log in on the website. This is that employee wellness challenge we were looking at. So all of the tracking data that the end user sees, you're also going to have access to here. You can see the point data, and then you can see the leaderboards. And what's nice is you can export this data right here into a CSV file so that you can manipulate it, slice it and dice it however you want. So one really cool feature that we just finished, Alicia, I don't even think I've told you this, but we have added the ability for you to add in demographic questions to challenges. So when a participant comes into a challenge, so you could choose not to do this or choose to do this, but if you choose to add them, when the participant enters the challenge, there's going to be a pop-up. It's going to ask them a series of questions that they enter. I'll show you what that looks like here in 1 second back in the app. But then you get access to that data here, the aggregated data. So this is an example of a challenge that has demographic data. We don't have a ton of, this is a test challenge, right? So there's not a lot of data here, but this shows you, we've got our age range, gender, race, and income and zip code. And so you've got this data here, aggregated data, and then you can export this data as well, which is super cool. So if I export this data and I open it up, let me make sure. Alicia, can you see this
Yes.
Excel file?
Yep.
Okay, perfect. And so not only do you have your point totals here, you also have your demographic questions. And so you've got your aggregated demographic data here, your values and your percentages that you can export, and then your zip codes, all the zip codes that have been entered here. So let me show you what the end user sees. So I'm going to go into this health department challenge on the app, and I want to show you what that looks like. So I have not entered the demographic data yet for myself, so I'm going to go into this challenge. And here's that pop-up. So I've got my demographic data. I select my information and I submit, and now I'm done. And so very easy for the user to do. That gives you the data back, and and you can collect. So let me go back to your admin console again, and I want to walk you through um, a challenge creation process, what it looks like to create a challenge. It's a very simple to do and very customizable. Again, if team challenges kind of make more sense for employee wellness. Again, everything I'm showing you also applies to employee wellness. So if you guys wanted to use this at your organization for employee wellness, you could as well. There's a way to add your employees in so they are unique to your organization and they're private within your organization. And then I'll show you the challenges that we're going to make are going to be open to the public and you can share them with whoever you want. So hypothetically, let's say we do a challenge. Let's call it get moving. Let's get our activity in. You can say whatever you want here. You can upload an image. And then here's where we could add the demographic questions if we want to add them in. Tells you what they're going to be answering. And then this is where we customize the goals. Again, you can have one goal in a challenge, you can have multiple goals. So for example, minutes of exercise. Let's say this is an exercise category. We want to encourage them to get exercise, but there's going to be some, let's say we've got some avid runners. I don't know if Carl Hansen is on the call. Like Carl, he would probably smoke everybody because he's a really fast runner. But we don't want Carl to like outpace everybody. So we're going to cap. So we could say we can set the maximum number of points allowed in a day that they can get. They can track as many points. They could track up to they could track 8 hours of exercise if they want, but they would only get 120 points. And then we're going to say for every minute, we'll give them 1 point. Now, all of this is customizable. And if this seems confusing or overwhelming, don't worry. We've got some videos we can send over that walk you through this process, or you could watch this webinar again. And we are here to help guide you. So again, this is my passion. I want to help. I want to help the country be healthier. I want to help Utah be healthier. I am here in Utah County. And so I am more than happy to schedule time with all of you, any of you, and we can walk you through this, help you create your account, help you create challenges, kind of feel it out. So if this seems confusing, don't be worried. But this example of a challenge would allow them to track minutes of exercise. Then back in the app, they would just enter the value. Oh, I exercised for 10 minutes, 50 minutes, 60 minutes, whatever it is. We pick our start and end date. And then if the time is not required, if you had a specific time, you could do that. But and then we're gonna put this on the map somewhere. So let's say we're in Mona, Utah. physically put this on a location on a map. I'll show you what that looks like in the app. And or we're going to give you a link to this challenge that then you can take that link. You could create a QR code with it and put it on a flyer, and someone could scan it, and then it would lead them to download the app, and then once they get into the app, it would take them to the challenge that they could join. And then we create this challenge and it's good to go. And so here's where we can get the link to the challenge if we want to grab this link to create a flyer, whatever it is, to share it in an email or however you guys want to do it. And you can get going. The other thing I want to say, and I think we might be getting some questions in the chat. I'll pause here in a second for that, is there's multiple ways to add goals in. You can do value-based goals like we have here, or we could do, let me just change this one. Let's say we wanted to make this a yes no goal. So instead of them tracking the number of minutes, we're just asking them, did you complete this goal or not? So we could phrase this differently. We could say 30 minutes of exercise a day or something like that, right? You can phrase it however you want. And then we're going to set the points that they're going to get for that. Let's say it's 30. But then when they track this type of challenge, a yes, no challenge, it's literally just asking them yes or no. Did you complete this? Did you do 30 minutes of exercise a day? Yes or no? Okay, let me pause there and let's go to questions. Let's see
Yeah.
if I can find them.
Got some in the chat. Yeah. So the first question is, can it be set up so someone can't see everyone's data? Kind of how does it look? Yeah, data wise in these challenges.
Yes. Okay. Great question. Right now, no, we don't have the option to turn off the leaderboard, I think is what you're asking for. So right now, all challenges have a leaderboard. So if you're participating, you can see how everybody else is doing. We are. We have features. We have a feature list of stuff we're building in. We have that on our feature list. It is in the pipeline, and so we are getting to that. So that is coming, but as of today, no.
The next question is, can this link up to a Strava account?
Another great question. We are also actively working on. So right now, as it sits today, if you wanted to create a challenge today, which you could, after this demo, if you wanted to sign up with Health Movement and create a challenge to start tomorrow, you could do it. It could go live immediately. As it sits today, there is no syncing ability with wearables or apps. That's also something we're actively working on. It's actually the number one priority for the programmers right now. We are almost done syncing Apple Health and Google Health. We're starting with those because even if you don't have a wearable device, but you have a smartphone, your phone will track steps and activity, right? So anyone with a smartphone could just sync to their Apple Health or their Google Health, and you could create a challenge that specifically requires them to sync a device, and it'll auto pull those steps in. And then once we're done with that, we're moving down the list. Next on the list is going to be Apple Watches, Fitbits, all the popular watches, right? And then we'll get to a Strava and the app. So we're actively working on syncing that data. That is coming very soon, but very, very soon. I'm hoping in the next week we will have Apple Health and Google Health available that you can. I've been testing it with the programmers on my phone in a demo version, and it's working well. And so it's pulling my steps in automatically that my phone is capturing.
Awesome. The next two questions are about the questionnaire and the demographic piece. Can you customize those demographic questions that you showed us at all? And then second, can you add additional questionnaires or links to the challenges to collect data outside of that challenge specific data?
Yeah, great question. Currently, you cannot alter the demographic data, but that is also on our in our pipeline to add in. So that will be coming, but currently it's set for these standard questions. And it's not required. I'll say again, you don't have to add in the questions if you don't want. And then adding in a link of your own, you could definitely here in the description, if you had a outside survey or something you wanted to push people to, you could definitely put it in there.
Great. Those are the questions for now, but feel free to add other questions in the chat as we continue.
Okay. So let's see, we've covered challenge creation. Um, I know there's, I've in meeting with health departments, organizations like yourself, um, steps challenges is probably the number one or one of the top challenges that people want to do. Again, you can do a steps challenge today. If you wanted to, you could say, we're just going to track steps, exercise. Hypothetically, someone could run, if they ran a marathon, I think it's like 60,000 steps or something. But maybe we just want to encourage people to get over 10,000. And so we allow for points. Well, let's just say we allow for points of 10,000. And so then we would just set it up like this. So you could create a step challenge today. It's manual entry. But again, hopefully in the next week or two, you'll be able to sync Apple or Google Health, and it would pull that step data in automatically. Um, let's see. So that's basic challenge creation setup and account overview, kind of what the end user sees, their experience. Let me touch on real fast the freemium model, what that means, because I seem every time I meet with an organization, I get this question: how do you make money? Right? And so I will say that I default to wanting to give everything away for free because I'm here for the mission, right? I am passionate about this. This is sort of like my life mission. It's why I chose what I went to in school. I'm trying to help solve the problem that you guys are all trying to help. We're just trying to help people achieve healthier lives. So I want to give this away for free as much as possible. Having said that, every organization has to keep the lights on. And so our model is this. Everything I've showed you today is free, free for an organization like yourself, free for an employer who wants to do employee wellness, free for the end user. So all of this is free. It doesn't cost you anything. If you go to the website to create an organizational account, you can do that today. It doesn't require a credit card or anything. Um, what's the catch? Some people say there is no catch. We are in our pipeline building out premium content, premium services. So, for example, there's a stats dashboard that we're working on that will go here that will be a premium feature that will add more robust reporting than what I've showed you today, with engagement. What is the engagement of my users? How much are they using it? Aggregated data, right? So some of these premium features we will charge for. That's how we make our money. But my goal and vision is that we can provide this tool at its core for free to you, because nothing like this exists, and it's a huge need and a huge gap, and ultimately we want to help you achieve the objectives that you're trying to reach in the communities that you serve. So that's the cost question. Does anyone have any additional questions about that piece? I just want to make sure it's clear to you that you can sign up, you don't need a credit card, and it is free to do everything that I've showed you today. The other thing I wanted to say is, when you're signing up, and Alicia, I didn't send this to you, but I have another PDF that walks you through creating an organizational account. It's a very simple step. It's very simple steps, but I can send it to you and you can send it out. Um, if you go to download the app, maybe some of you have gone to the App Store while we've been talking right now and you've downloaded the app on your phone. If you've downloaded it on your phone, you have signed up for an individual account. Think of there's two user types, organizational accounts and individual accounts. The organizational account is this account that I'm showing you right now. This is the admin account where you would create these challenges for your organization that you would push out. Keep those separate. So sign up for an organizational account through the website. You need an organizational email, and think of it as an admin account. And then if you want to participate in these challenges that you've created, that's awesome. Create your own personal individual account with a separate email. It can be a personal email or it could be a work email. It just has to be different than the one that you created with the organizational account. Any question, because the functionality is different. What an individual can do and create and the type of challenges they can create is different from what an organization can create. And so you don't have this same functionality. An individual does not have this same functionality that an organizational has through an organizational account. So I just want to make sure that's clear because there have been some who've been confused with that. Any questions about that?
Yeah, there's a question on, can you have multiple individuals slash emails tied to one organizational account, essentially multiple users for the org account?
Multiple admins, I'm guessing, right?
Yes.
Right now, no. That's also in our pipeline. We're a scrappy startup, guys, so we are working hard and fast to get as many features built in as possible, and we're making great progress. But so right now, no, there is only one admin email. So I would just pick an email and a login that if you had multiple people that needed to get in, you could share that. That's totally fine. You can share it with however many people you need to, but there would only be one admin account and email.
And then the other question is, for the premium account, is it still based on user account input rather than admin input? I don't know if I understand that, if you understand that.
Can you read it one more time?
For the premium account, is it still based on user account input rather than admin input? And Sydney, I don't know if you want to come off mute and explain exactly what you're trying to get at.
Yeah, I can clarify. So
Okay.
at the state, we have a lot of evidence-based interventions that we oversee, especially due to grants, and they require attendance. And so we wouldn't necessarily want the user of like to enter in their own attendance. We have like a facilitator of a program enter in the attendance. So I don't know if that kind of clarifies things, but basically we would, if we were to utilize this, we would need the facilitator that's trained in the program to have the ability to enter the data rather than the user to enter the data. Does that make sense?
Yep, that totally makes sense. Yeah. Yes. That is also on our list to add. Currently today, not there. So if you wanted to use this and create, you've got your groupings and the facilitator is entering in all values for people in there. That functionality is not live, but it is on our list to add in.
Gotcha.
But
Okay.
but to clarify on that, if you wanted to, let's say you've got challenges that are kind of open to the general public that anyone in the community could join. You're not limiting that at all. That's the type of challenge that I showed you.
Hmm.
If you had specific groups that you are okay with them manually tracking, but you only want the invite to go out to this subset of individuals, 50, 10, whatever it is. You could create those groupings here. You essentially would send them, you would invite them through either a referral link or you would enter their email and name here. They would get an invite that they would accept from your organization. And then that would allow you to create unique challenges to a specific group, and then you could send it out to only these 30 people. So you could have a a challenge or whatever you're tracking for this this group of 30 people here, and you have a different one going on for this group of 30 people here, and they're isolated, and they're not we're not sharing challenges across and it's not open to the general public, if that makes sense.
Gotcha. Thank you.
Yeah.
The next question is, how many teams can there be? Can you assign certain users to teams, or did they get to pick their team? And can you name the teams whatever you want?
Yeah, great question. Yep. So you can have as many teams as you want. You assign who goes to what team, and you specify the name of the team image or logo if you want, etc. So all of that is customizable to you. You also have the ability to save teams. So down here on the user page, we have the teams. So in this example, we've got these teams we created for an organization, and you could save them so you could use them later as well when you create a team if you wanted. So yes, all of that is customizable. You can create as many teams as you want. You can name them whatever you want. In the pipeline as well is an option if you wanted to give the users the ability to create their own teams and specify which teams they're on. That's not live yet today, but that is coming. So
Okay, I think you answered, yeah, this other question says, is it only the, oh yeah, Natalie deleted it. Okay, it's like you answered the team who can name it and so forth, so.
awesome.
I think that's it in the chat. If others have questions, feel free. We have about, a little over 5 minutes. Or you can come off mute. So if anyone would like to come off mute and ask a question or give feedback or thoughts, we did have some comments on just how awesome this is, and thank you for creating this. This is amazing. So we have that in the chat as well. So feel free if people want to come off mute to ask Rich anything.
I have a quick question. I'm the state diabetes coordinator, and we do the National Diabetes Prevention Program. So I was the one that asked about the not seeing the leaderboard. Do you have any ideas of when that might show up?
Yeah. Good question. I kind of chuckle because development. I'm not a programmer. I don't know if any of you are programmers. It's like one of those black holes, right? Where it's like, and so I would think I always whatever my programmers tell me, I always double it. Like they're like, oh yeah, this will take 2 weeks. I think, oh yeah, it's probably take 5, like 4 or 5, right? So I think that could be in the next month or two. We just got other things that are higher priority that we're working on, like syncing the wearable devices and stuff. But I think in the next like 30 to 60 days, that one should be live. Is there a specific time frame that you're looking for?
No, it would just be a great, I'm not sure if you're aware of the National Diabetes Prevention Program, but this could be a great tool for all our organizations across the state to use this as far as in that program. Participants are required to record and track their weight and their physical activity minutes and physical activity they're doing. So it'd be kind of a way for a coach to work with their participants. So just wanting in general. And then where are you based out of, Rich? Are you like in Utah or?
Yeah, I'm in
Okay.
South Utah County.
Oh, nice. Okay.
Yeah. Where are
I'll
you?
be in touch. I'm up in Logan, but I'm with the state. So
Awesome. Yeah.
I will be probably reaching out.
Awesome. Awesome. Yeah, no, I would love nothing more than to have this, like, if we can, and this is something that I've told Alicia. She was the one that asked for the demographic data. And so I love hearing, hey, we have this specific need. It would be really awesome if you could, if the platform could do this, any of that stuff. I want to hear it because I want to build this to be as useful as possible for what you guys are trying to do. So I would love to be able to get it to that place for you, of course.
Thank you.
Yeah.
Here we have Kristen with her hand raised. Kristen, go ahead.
A question. So if we're an organization that chooses to do one of the premium features, and we pay for that, does the individual who signs up for it have to pay the premium, or is it just on the organizational end that they pay for that?
Yeah, yeah, only the individual wouldn't have to pay anything additional. If there's any premium features, it's just a one time, the organization pays it. And I also, just so you know what the fee structure is going to be like, a lot of platforms out there charge you like per user basis. I don't like that type of fee structure. So it'd just be like, it's like the premium features will just be like a flat monthly fee. And you're not locked into, so it'd be like you can just use it this month, you could cancel it the next month, or you could pay for a year to get a discount, right? But it'd be a flat fee, and then you have access to those tools, and any of the users, they're not having to pay anything additional.
Thank you.
Yep, great question.
We have about 2 minutes left. Oh, we have two more. Oh, another question. Sydney, go ahead.
Yeah, so I have another question then about that. So if we request updates to be made, like you were mentioning, Rich, that kind of would be more specific to our programs, would that be an additional? I just know a lot of our other platforms, they require an additional fee for build out. So would that also?
Yeah, so great question. I would say this. I would say if it's a feature that we feel like we want everyone to be able to access, like the one I think Pam was asking about, like if it's something that is going to be, we're not going to ask specifically for you to build it out. If it is very niche and unique and specific just to your organization, then we could have that conversation. I don't, I kind of assume that it would be useful to others as well, but we could talk through that. But I would assume no. I would assume that it wouldn't be a specific cost. It's probably already in our pipeline, and it's something we're going to get to. If this is something I hadn't really thought through, but if you guys had a very specific need and it was like, hey, we need this in 60 days, and it would be really helpful for us, and we'd be willing to pay to expedite it, then that could be a conversation. Because if we say, yeah, we're going to get to that in like 6 months or something, and you guys would really like it now, then we could maybe talk about moving it up and getting it done faster. But otherwise, we wouldn't charge you extra.
Okay, awesome.
Yeah. Great question. And again, I know we're going to end here soon, but please reach out to me. Oh, let me go to my slide, and you're going to get this, but my email is rich@healthmovement.com. This is my cell phone. Please call me. This is a Seattle number. I'm from Utah, but I moved to Seattle way back after college, and my boss, I was in healthcare, and he made me get a Seattle number. So I have a Seattle number and I haven't changed it. But please reach out to me if you have any questions. I want to help guide you through this process as much as you want. And I'd love to give you a demo, help you set up, all that. So don't hesitate. And if you have suggestions, this feature, we'd love this feature. Give me your list of features that you would love. We want to make this as user-friendly and easy for you to use.
Awesome. Thank you so much, Rich. I've got connected with him. Carl Hansen is on our Get Healthy Utah board. And so when we met with Rich, probably about 6 months ago, we were just excited for his enthusiasm and just to be an advocate in this space. And like you heard, he wants to provide all he can for free and really create this platform and this tool for us to use. So we're grateful to you, Rich, for wanting to listen to our suggestions and working with us. This has been a great webinar. So again, we'll have this recording. I'll send out a copy of the slides and some of the flyers that Rich has. Again, I threw his email in the chat as well, so you can follow up with him. And he'll also be presenting at the Utah Worksite Wellness Council Worksite Wellness event April 30th. So if you're going to that event or would like to go to that event and learn more about Worksite Wellness programs and things, that he'll be there as well. So thank you, Rich, for being here. And I hope everyone has a good rest of their Wednesday. Thank you.
Thanks, guys. Appreciate it.